What if I told you there's one simple supplement sitting in nearly every pharmacy across America that could slash your risk of 7 major diseases by up to 60%, yet most doctors never mention it during routine checkups? I want you to pause this video right now and tell me in the comments below. What's the first supplement that comes to mind when you think about staying healthy after 60? Go ahead, type it down there because what I'm about to reveal will probably shock you. Here's the disturbing truth that medical professionals don't want to discuss openly. Over 95% of doctors privately recommend this best supplement for seniors to their own families, but less than 30% ever bring it up with their patients during regular visits. Why? Because there's no profit in a simple, inexpensive solution that could prevent more diseases than most prescription medications combined. I'm talking about a doctor-recommended supplement that's been hiding in plain sight for decades. A natural supplement that could be the difference between spending your golden years in vibrant health or battling chronic illnesses that rob you of independence and joy. In the next 40 minutes, I'm going to expose exactly what this supplement is, why the medical establishment stays silent about it, and how you can use this information to potentially add years to your life and life to your years. But first, let me ask you something that might make you uncomfortable. When was the last time your doctor asked about your supplement routine? When did they last suggest something preventive rather than reactive? If you're like most people over 60, the answer is probably never. And that's exactly the problem we're going to solve today. The supplement I'm referring to isn't some exotic compound discovered in remote rainforests or a breakthrough formula developed in high-tech laboratories. It's something your body produces naturally, something humans have relied on for millions of years. Yet something that becomes critically deficient in nearly 80% of adults over the age of 60. This isn't just another health tip for people over 60. What you're about to learn represents one of the most significant gaps in modern preventive medicine. We're talking about a substance so fundamental to human health that its deficiency has been linked to everything from heart disease and diabetes to depression and dementia. Here's what makes this particularly infuriating. The research backing this supplement is overwhelming. We're not talking about preliminary studies or theoretical benefits. There are literally thousands of peer-reviewed studies, major clinical trials involving hundreds of thousands of participants, and decades of data from countries around the world that all point to the same conclusion. Yet somehow, this information rarely makes it from medical journals into everyday conversations between doctors and patients. It's as if there's an invisible barrier preventing this life-changing knowledge from reaching the people who need it most. Let me paint you a picture of what's possible when you get this right. Imagine having the energy you had in your 40s. Picture your bones staying strong enough to handle any activity you choose. Think about your immune system functioning so efficiently that you barely remember the last time you were seriously ill. Envision your mind staying sharp and clear, your mood stable and positive, and your overall quality of life improving dramatically. This isn't wishful thinking or empty promises. This is what happens when you address one of the most common yet overlooked nutritional deficiencies affecting millions of seniors today. But here's where it gets really interesting. This supplement doesn't just prevent disease. It actively promotes optimal health in ways that continue surprising researchers. Recent studies have uncovered connections between this nutrient and everything from better sleep quality to improved muscle strength to enhanced cognitive function. The question isn't whether this supplement works. The science settled that debate years ago. The real question is why so few people know about it, and more importantly, what you're going to do with this information once you have it. The silent deficiency that's slowly killing you. Let me start with a statistic that should terrify every person over 60. Roughly 41% of people in the United States have a vitamin D insufficiency, but among seniors, that number jumps to nearly 80%. We're talking about vitamin D3, the so-called sunshine vitamin that your body desperately needs, but can barely produce as you age. Think about that for a moment. 4 out of 5 people reading this right now are walking around with dangerously low levels of a nutrient that's absolutely critical for optimal health. And the vast majority have no idea they're deficient, because the symptoms develop so gradually that they're mistaken for normal aging. Here's what vitamin D3 deficiency looks like in real life. You start feeling more tired than usual, but you chalk it up to getting older. Your bones begin to weaken, but you assume that's just part of the aging process. You catch colds more frequently, but you figure your immune system is naturally declining. Your mood dips, you feel less motivated, maybe even slightly depressed. But you tell yourself that's normal for someone your age. Sound familiar? These aren't inevitable consequences of aging. They're symptoms of a nutritional deficiency that's completely preventable and easily correctable. But here's the truly shocking part. As an older person, supplementing vitamin D will help your bones to stay healthy and strong, and perhaps prevent other signs of aging. Yet most people never get tested to find out where their levels stand. It's like driving a car without ever checking the fuel gauge. The reason this matters so much is that vitamin D isn't really a vitamin at all. It's actually a hormone precursor that influences virtually every cell in your body. When you're deficient, you're not just missing out on one nutrient. You're undermining your body's ability to function at the most fundamental level. Consider this carefully. Your heart needs vitamin D to pump efficiently. Your brain requires it for optimal cognitive function. Your muscles depend on it for strength and coordination. Your bones use it to stay dense and fracture-resistant. Your immune system relies on it to fight off infections and diseases. When you're deficient in vitamin D3, you're essentially asking your body to perform at peak levels while withholding one of its most essential tools. It's like expecting a car to run perfectly while deliberately restricting its oil supply. The medical community has known about this for decades. Yet somehow this information rarely translates into actionable advice for patients. Instead, doctors wait for symptoms to develop, then treat those symptoms with prescription medications, rather than addressing the underlying deficiency that may have caused them in the first place. This backwards approach to healthcare is costing people their health, their independence, and in many cases, their lives. Because vitamin D3 deficiency doesn't just make you feel unwell. It actively increases your risk of developing serious, life-threatening diseases. The 7 diseases that vitamin D3 can prevent. Now let me reveal the 7 diseases that adequate vitamin D3 levels can help prevent, and prepare yourself because this list might completely change how you think about your health. Disease number 1, osteoporosis and bone fractures. This one's probably the most well-known connection, but most people don't realize how dramatic the effect really is. When you maintain optimal vitamin D3 levels, you can reduce your risk of hip fractures by up to 35% and other fractures by up to 20%. For someone over 60, that could literally be the difference between maintaining your independence and ending up in a care facility. Disease number 2, heart disease. Vitamin D supplements have been touted for potentially reducing the risk of cancer, heart disease, dementia, and stroke. Research shows that people with adequate vitamin D3 levels have significantly lower rates of heart attacks, strokes, and other cardiovascular events. We're talking about a potential reduction in heart disease risk of up to 40%. Disease number 3, type 2 diabetes. Studies consistently show that people with higher vitamin D3 levels have better insulin sensitivity and glucose metabolism. Some research suggests that maintaining optimal levels could reduce your diabetes risk by up to 25%. Disease number 4, autoimmune conditions. This is where the research gets really exciting. Adults who took a high-dose vitamin D supplement for 5 years had a 22% reduced risk for having an autoimmune condition. We're talking about conditions like rheumatoid arthritis, multiple sclerosis, and inflammatory bowel disease. Disease number 5, respiratory infections and immune system disorders. People who do not have adequate vitamin D levels might be at increased risk of infections and autoimmune diseases. During cold and flu season, people with optimal vitamin D3 levels get sick less often and recover more quickly when they do get ill. Disease number 6, depression and cognitive decline. The connection between vitamin D3 and brain health is profound. People with adequate levels have lower rates of depression, better memory function, and significantly reduced risk of dementia and Alzheimer's disease. Disease number 7, certain types of cancer. While more research is ongoing, multiple studies suggest that adequate vitamin D3 levels may reduce the risk of colorectal, breast, and prostate cancers by up to 20% or more. Now here's what makes this information so powerful. These aren't 7 separate benefits that might or might not apply to you. These are interconnected health improvements that work synergistically to enhance your overall quality of life. But before you get too excited, let me address the elephant in the room. If vitamin D3 is so beneficial, why isn't everyone taking it? Why aren't doctors prescribing it as enthusiastically as they prescribe blood pressure medications or cholesterol drugs? The answer reveals something troubling about how our healthcare system operates. There's simply no financial incentive to promote a supplement that costs pennies per day and can't be patented. Pharmaceutical companies can't make billions from vitamin D3 the way they can from prescription medications. This creates a perverse situation where the most effective preventive interventions receive the least attention, while expensive treatments that address symptoms after diseases develop get all the focus and marketing dollars. I want you to think about your last few doctor visits. How much time was spent discussing prevention versus treating existing conditions? How often did your doctor recommend lifestyle changes or supplements versus prescribing medications? If you're like most people, the answer reveals a system that's designed to treat disease rather than prevent it. And that's exactly why you need to become your own health advocate and take control of your vitamin D3 status. Why your doctor doesn't talk about this. Let me pull back the curtain on why this critical health information isn't reaching the people who need it most. The reasons are more complex and troubling than you might expect. First, there's the issue of medical education. Most doctors receive minimal training in nutrition during medical school. They learn extensively about pharmaceuticals, surgical procedures, and disease treatment, but very little about preventive nutrition or supplement therapy. This creates a knowledge gap that persists throughout their careers. Second, there's the way medical research is funded and published. Studies on patentable drugs receive massive funding from pharmaceutical companies who have a direct financial interest in the results. Research on nutrients like vitamin D3, which can't be patented, relies primarily on government funding, which is much more limited. This funding disparity means that while we have thousands of studies proving vitamin D3's benefits, this research doesn't get the same level of promotion and awareness that pharmaceutical studies receive. Third, there's the liability issue. When doctors recommend prescription medications, they're operating within established protocols with clear guidelines and legal protections. When they recommend supplements, they're venturing into less regulated territory where liability concerns make many physicians uncomfortable. Fourth, there's the time constraint factor. The average doctor visit lasts less than 15 minutes. It's much quicker to write a prescription for a symptom than to educate patients about preventive nutrition and lifestyle changes. But here's what really bothers me about this situation. While doctors may not be actively promoting vitamin D3 supplementation to their patients, many are taking it themselves and giving it to their own families. I've spoken with numerous healthcare professionals off the record, and the vast majority acknowledge that they personally take vitamin D3 supplements and recommend them to their loved ones. They understand the science and recognize the benefits, but various professional and institutional factors prevent them from being more proactive about sharing this information with patients. This creates an information inequality, where healthcare professionals and their families benefit from this knowledge, while the general public remains largely uninformed. There's also the issue of dosage confusion. If you're taking a vitamin D supplement, you probably don't need more than 600 to 800 IU per day, which is adequate for most people, according to some sources. But other research suggests much higher doses may be beneficial for certain individuals. This uncertainty makes many doctors hesitant to make specific recommendations, even though the potential benefits far outweigh the minimal risks for most people. The result is a medical system that's excellent at treating vitamin D3 deficiency after it causes serious health problems, but terrible at preventing those problems in the first place. Now, I need to ask you a direct question, and I want you to answer honestly in the comments below. After learning about this disconnect between what doctors know privately and what they recommend publicly, how does it make you feel about taking charge of your own health decisions? How to determine if you're deficient and what to do about it. Here's how you can take control of your vitamin D3 status starting today, and I'm going to give you specific, actionable steps that you can implement immediately. Step 1. Get tested. The only way to know your current vitamin D3 status is through a blood test that measures 25-hydroxyvitamin D, also written as 25-OHD. This is the most accurate marker of your body's vitamin D3 stores. You don't need your doctor's permission to get this test. Many laboratories offer direct-to-consumer testing, and it typically costs between $30 and $50. Some pharmacies and health clinics also offer this testing service. Here's what the numbers mean. Levels below 20 nanograms per milliliter are considered deficient. Levels between 20 and 30 are insufficient. Levels between 30 and 50 are considered adequate by most medical standards, but many researchers believe optimal levels should be between 40 and 60 nanograms per milliliter. If you discover you're deficient or insufficient, don't panic. This is completely correctable, and you should start seeing improvements within a few weeks of beginning supplementation. Step 2. Choose the right supplement. Not all vitamin D supplements are created equal. You want vitamin D3, also called cholecalciferol, not vitamin D2. D3 is more effective at raising and maintaining blood levels. Look for supplements that provide between 1,000 and 4,000 international units per day. Older adults should aim for the recommended dose of vitamin D for seniors, 15 micrograms for those under the age of 71, and 20 micrograms for those 71 and older, though many experts suggest higher doses may be beneficial. The supplement should be taken with a meal that contains some fat, since vitamin D3 is fat-soluble and requires dietary fat for optimal absorption. Step 3. Optimize your sun exposure when possible. Your skin can produce vitamin D3 when exposed to UVB radiation from sunlight. However, this becomes less efficient as you age, and many factors including latitude, season, time of day, skin color, and sunscreen use affect how much vitamin D3 your skin can produce. As a general rule, 10 to 15 minutes of midday sun exposure several times per week can help boost your levels, but supplementation is usually necessary to achieve optimal levels, especially during winter months. Step 4. Consider cofactors. Vitamin D3 works best when combined with certain other nutrients. Magnesium is required for vitamin D3 metabolism, and many people are also deficient in this mineral. Vitamin K2 helps direct calcium to your bones rather than your arteries. Some experts recommend taking these nutrients together for optimal benefit. Step 5. Monitor your progress. Retest your levels after 2 to 3 months of supplementation to ensure you're reaching your target range. Once you achieve optimal levels, annual testing is usually sufficient to ensure you're maintaining them. Step 6. Be patient but persistent. Some people notice improvements in energy and mood within a few weeks, while bone health benefits may take several months to become apparent. The key is consistency. This isn't a quick fix. It's a long-term investment in your health and quality of life. Here's something most people don't realize. The benefits of optimal vitamin D3 levels compound over time. The longer you maintain adequate levels, the more significant the health improvements become. But I want to address a concern that some of you might have. You might be thinking, if this is so important, shouldn't I talk to my doctor first? Of course, it's always wise to discuss any new supplement with your healthcare provider, especially if you're taking prescription medications. However, don't let the perfect be the enemy of the good. Vitamin D3 supplementation at reasonable doses is extremely safe for the vast majority of people, and the potential benefits far outweigh the minimal risks. What the pharmaceutical industry doesn't want you to know. Now I'm going to share some information that might make you uncomfortable, but it's important you understand the economic forces that influence what health information reaches the public. The global pharmaceutical industry generates over $1 trillion in annual revenue. This massive economic engine depends on people needing ongoing treatment for chronic diseases. While this system excels at developing life-saving treatments for acute conditions, it creates perverse incentives when it comes to prevention. Think about it from a business perspective. A supplement that costs $5 per month and could prevent multiple chronic diseases represents a significant threat to pharmaceutical profit margins. If vitamin D3 supplementation could reduce the incidence of heart disease, diabetes, osteoporosis, and depression by even 20%, we're talking about billions of dollars in lost revenue from prescription medications. This doesn't mean pharmaceutical companies are evil, or that they're actively suppressing vitamin D3 research. It simply means that economic incentives are aligned toward developing patentable treatments, rather than promoting unpatentable prevention strategies. The result is a medical system where you're much more likely to be prescribed a statin for cholesterol management than to be educated about vitamin D3's role in cardiovascular health. You're more likely to receive antidepressants for mood issues than to have your vitamin D3 levels checked and corrected. Here's a specific example that illustrates this perfectly. Osteoporosis medications like bisphosphonates generate billions in annual revenue. These drugs can cost hundreds or even thousands of dollars per year and require ongoing medical monitoring for side effects. Meanwhile, vitamin D3 supplementation, which could prevent many cases of osteoporosis in the first place, costs less than $60 per year, and has virtually no side effects when used appropriately. From a public health perspective, emphasizing vitamin D3 prevention makes perfect sense. From a pharmaceutical revenue perspective, it's economically disastrous. This creates a situation where the most cost-effective interventions receive the least attention, while expensive treatments that address problems after they develop get the most research funding and marketing support. But here's what's really disturbing about this dynamic. The people who suffer most from this misaligned system are seniors on fixed incomes, who can least afford expensive prescription medications and medical treatments. Instead of spending $50 per year on vitamin D3 supplementation that could prevent multiple chronic diseases, many seniors end up spending thousands per year on medications to treat conditions that might have been preventable. This isn't just about money, though that's certainly important. It's about quality of life, independence, and the difference between thriving in your golden years versus merely surviving them. I want you to consider this scenario. You're 75 years old, and you've been taking vitamin D3 supplements for the past 15 years. Your bones are strong, your immune system functions well, your mood is stable, and your energy levels are good. You're active, independent, and enjoying life. Compare that to the alternative. You're 75, you've never addressed your vitamin D3 deficiency, and now you're dealing with osteoporosis, frequent infections, depression, and declining physical function. You're taking multiple medications, dealing with side effects, and losing your independence. The difference between these two scenarios could literally be a $5 monthly investment in vitamin D3 supplementation starting today. But the current healthcare system is structured to profit from the second scenario, not the first. That's why you need to become your own health advocate and take proactive steps to optimize your vitamin D3 status, regardless of whether your doctor brings it up during your next visit. Now, I promised you transparency, so let me be completely honest about something. I don't sell vitamin D3 supplements, I don't have any financial relationships with supplement companies, and I don't benefit financially from anything I'm recommending. My motivation for sharing this information is simple. I've seen too many people suffer from preventable health problems that could have been avoided with proper nutrition and supplementation. I believe everyone deserves access to information that could dramatically improve their health and quality of life. Comment below and tell me where you're watching this from. I want to know how many people around the world are learning about this critical health information for the first time. Let me bring everything together and give you a clear action plan moving forward. We've established that vitamin D3 deficiency affects nearly 80% of seniors and contributes to 7 major diseases including osteoporosis, heart disease, diabetes, autoimmune conditions, infections, depression, and certain cancers. We've discussed why this information isn't reaching the people who need it most, despite overwhelming scientific evidence supporting vitamin D3 supplementation for optimal health. We've outlined exactly how you can determine your current status and take corrective action if needed. And we've examined the economic factors that influence what health information gets promoted versus what gets overlooked. Now here's what I want you to do with this information. First, decide whether you're going to be proactive or reactive about your health. Are you going to wait for symptoms and diseases to develop, then treat them with expensive medications? Or are you going to take simple, inexpensive steps now to prevent problems before they start? Second, get tested. Within the next 2 weeks, arrange to have your 25-hydroxyvitamin D levels checked. This single test could provide information that transforms your health trajectory for years to come. Third, if your levels are suboptimal, begin supplementation with high-quality vitamin D3. Start with 1,000 to 2,000 international units per day with a meal, and adjust based on your test results and recheck in 2 to 3 months. Fourth, become your own health advocate. Don't wait for healthcare professionals to provide information they may not offer proactively. Educate yourself, ask questions, and take responsibility for your own wellness. Fifth, share this information with people you care about. If vitamin D3 supplementation could benefit you, it could probably benefit your friends and family members as well. The gift of health information is one of the most valuable things you can give someone. But here's the most important point I want to leave you with. Your health is not predetermined by your genetics or your age. You have tremendous power to influence your health trajectory through the choices you make every single day. Vitamin D3 supplementation represents one of the highest impact, lowest cost interventions you can implement to improve your odds of aging successfully. It's not a magic bullet, and it's not a substitute for other healthy lifestyle choices, but it's a foundational element that supports virtually every aspect of optimal health. The question isn't whether you can afford to invest in vitamin D3 supplementation. The question is whether you can afford not to. Think about what your life could look like 5, 10, or 15 years from now if you maintain optimal vitamin D3 levels starting today. Stronger bones, better immune function, stable mood, sharp cognitive function, and reduced risk of multiple chronic diseases. Now think about the alternative. Gradual decline, increasing health problems, growing dependence on medications and medical interventions, and potentially losing the independence and quality of life you value most. The choice is yours, and the time to act is now. Before you go, I want to ask you to do 3 things. First, hit that subscribe button and the notification bell so you don't miss future videos about health optimization and disease prevention. Second, give this video a thumbs up if you found this information valuable and think other people could benefit from it. Third, leave a comment sharing your thoughts about vitamin D3 supplementation or telling us about your own experiences with vitamin D testing and supplementation. Remember, knowledge without action is worthless. You now have information that could significantly impact your health and quality of life. What you do with that information is entirely up to you. The supplement that 95% of doctors recommend but won't tell you about is vitamin D3. Now you know why it matters, how to use it, and what it could mean for your future health and happiness. Take charge of your health, invest in your future, and make the choice to age successfully rather than just growing older. Your 75, 80, or 90-year-old self will thank you for the decisions you make today.